Hello, my name is Kennedy. I'm going to be your nurse practitioner today.
Hi.
Do you want to tell me your name and birthday?
My name is Samantha and it's October 27th. I'm 16 years old.
Perfect. All right, that's just what I have here. And so it also looks like when I was reviewing your chart that you have a mother and a grandmother with history of asthma as well.
Correct.
And we're here kind of just to check in on how your asthma's doing.
It's doing okay. I feel like I'm only needing to use the inhaler a couple times per week.
Good. That's awesome. Yeah. So based on all of my reading, it looks like you were diagnosed at about 9 years old. Does that sound right to you?
That's correct.
Good. So hopefully, with living with this for a while, you kind of have an idea on different techniques to work around your asthma. And it looks like, based on your chart, that your asthma was considered mild prior to. Would you kind of say that it's pretty much been the same the past couple of years?
Yeah, it feels pretty mild to me.
Good, good. And only using this inhaler a couple times a week really classifies you as mild, so that's great. And so we're gonna move into a further assessment. And based on your, but I would listen to your lungs. And when I'm listening to your lungs, on your back here. Thank you. I don't hear any wheezing, so that is great news as well. So kind of going through what asthma is and the plan for today. If you have any questions, please stop me, okay? So asthma is a complex chronic respiratory disease that is resulted from inflammation, airway hyperresponsiveness, and airway remodeling. Asthma can present itself in ways such as coughing, wheezing, which are typically the most common, but also chest tightness and breathlessness, and even can get into respiratory distress. So if we get to that respiratory distress, that's really not good. And at that point, I want you to be calling 911 or getting help right away, okay? It also sometimes can present itself as just a persistent cough. So would you typically say like you get wheezy when you feel like you need your inhaler?
Yeah, normally it's when I'm exercising.
Good.
But I just start to feel a little bit of like tightness and wheeziness.
Good. Okay. Perfect. And so based on what I'm hearing and what I'm sounding, I am not planning on changing any of your therapy currently. We're going to stick with just this albuterol inhaler as needed, 2 puffs at a time, and really try and keep an eye on this back number here. It shows how many puffs you have left. So it looks like you have 160 puffs left. So I know you probably know how to use this, but I just like to re-go through it with all of my patients. So we're gonna shake our inhaler to mix the medication with the gas that's in here. And then you take your cap off, you put your lips around here, and you press this top button. If you have your spacer at home, it can help create more distance between your mouth and the medication, which helps you inhale more. So I want you to use that spacer if you're at home, but if you're obviously at school and you don't have it, then this is just fine. Wait a couple minutes in between and then do your second inhaler, your second puff, okay?
Okay.
Do you have any questions on this?
No.
Perfect. So, I know you don't use it typically more than once a day. But if it gets to the point where you feel like you're needing it more than once a day, you can use it every 4 to 6 hours, okay? 2 puffs every 4 to 6 hours. If it gets to the point where you're using it 3 to 4 times per day, then that's when I want you to call me and give me a heads up. If you're having an acute respiratory issue, such as like an upper respiratory infection, we may need to order some steroids or a different inhaler. If you are not having any acute symptoms and you're just having to use it more often, like even daily, I want you to call and let me know, because then I can get an inhaled steroid ordered that can really help calm things down so you don't feel like you need your rescue inhaler quite as often. Okay?
Okay.
All right.
Sounds
So we are going to just talk through what the peak flow meter steps are. So basically, when you are working with your peak flow meter, which helps determine what level your asthma is at in our green, yellow, or red stage, we're gonna have you stand up, and then I'm going to have you make sure that the indicator is at the base of the numbered scale, so it's down at the bottom. And then I'm gonna ask you to take a big deep breath in, and then we're gonna put the peak flow meter in our mouth, and then you put your lips around it, and make sure you don't cover the hole, okay? Otherwise you'll mess your numbers up. And then you're gonna blow out as hard and as fast as you can. So we're gonna record that rate, but if you cough, then that doesn't count. And then we're gonna do it 2 more times after that, and then we're gonna record the highest of those 3 for your numbers, okay? So, based on your height being 5'4" or 64 inches, your peak expiratory flow for normal children your age and size is 427 liters per minute. So that number should be around there. So the yellow zone for the asthma that with your height is 214 to 342. So really, if you're above that 342, so 343 and above, you'd still be in the green zone, even if you're not hitting that highest 427, okay?
Okay.
And then the red zone would be 214 or less. So with that specifically, if you're getting to the yellow zone and you use, so if you're in the yellow zone, which as we go through our asthma care action plan here, I am going to give you a copy of this so you can have it at school. So if you get into the yellow zone, then I want you to do 4 to 8 puffs, and you can repeat that every 20 minutes as needed for 3 doses, okay? So this is in a more of an emergency situation. Typically, if we use our yellow zone treatment plan, then it can get you back to that green zone. If you use your yellow zone treatment plan, it does not get you back to that green zone, I want you to call me or call 911 right away, okay? Because you can get very quickly to that red zone. And based on your mild history of asthma, the red zone is not somewhere that you are ever going to be comfortable with being at. So we're not gonna necessarily give you medications right away. If your asthma worsens and you continue to get to that yellow zone quite often, then I will think about adding in a daily medication and some more emergency medications for you to have when you go home for more control. And also on the back of this sheet, it shows how to control things that affect your asthma. So like we talked about that exercise, we're gonna do 2 puffs 5 minutes before exercising. And then things that it shows that you are allergic to here that can trigger your asthma are animal dander, indoor mold, and pollen and outdoor mold. So all of those things I want you to try and avoid as much as possible. If you need to take antihistamines such as Zyrtec or Claritin during the season changing to help with that pollen and the outdoor stuff, or if you know you're going to be around pets that have dander, that could be a great option to try and reduce your need for this inhaler, okay? Do you have any questions for me today? No. Do you need a refill today?
Yeah, I'm getting low.
Okay, so I will write you a new refill. You can pick that up, and then if you need anything else, just give me a call, okay?
All right.
And I'll make sure you have your treatment plan. That way you can have it at school. I'd give it to your coaches so they have that, especially because it's exercise induced. and make sure it's on file at the office too, okay?
All right, sounds great.
All right, well, have a great day. It was very nice chatting with you.
Nice meeting you too.